Thanks for staying with us to this point. From our discussion, we've been able to x-ray that diabetes mellitus is a chronic metabolic condition whereby the body fails to produce enough insulin or is unable to use the produced insulin. And as we know, insulin is necessary for driving in glucose into the cell, which is necessary for ATP production needed for metabolic processes that happens in the body. Though there are so many types of diabetes mellitus, like we have type 1 diabetes mellitus, type 2 diabetes mellitus, we also have gestational diabetes, and we also have drug-induced diabetes. But we focused on type 1 and type 2 diabetes mellitus. Now let us go into the type 1 diabetes mellitus. Type 1 diabetes mellitus is seen in a condition where there's autoimmune destruction of the beta cells of cells of Langerhans. Okay, in this condition, there is either one or two autoimmune disease. Okay, now what happens in this is that during the destruction of these beta cells of cells of Langerhans, that means there will be decrease in the production of insulin, which is necessary to drive glucose into the cell needed for energy production. This insulin is necessary for driving in glucose into the cell needed for production of ATP, needed for metabolic processes. All right, now this is also known as type 4 hypersensitivity reaction, whereby the immune system, the T cells, especially the T cells, attack our own body cells, leading to autoimmune destruction of the beta cells of the cells of Langerhans. All right, let's go into type 2 diabetes mellitus. Type 2 diabetes mellitus is characterized by insulin resistance and progressive beta cells dysfunction, leading to chronic hyperglycemia. All right, let's talk about the risk factors. There are so many risk factors associated with diabetes mellitus. One, we have autoimmune disease, just like we have in type 1 diabetes mellitus. We also have family histories. Most people that have history of diabetes mellitus running in their families. Okay, we also have unhealthy diets. Most of us that eat, like most people that eat junk foods, have unhealthy diets, as we mentioned. Let's discuss the risk factors associated with diabetes mellitus. First and foremost, talk about autoimmune disease. As we discussed, that autoimmune diseases that you can see in the type 1 diabetes mellitus can trigger autoimmune destruction of the beta cells. All right, let's also talk about family history. We also discussed that family history can also lead to this, because we see that most people, diabetes mellitus runs in their families. Also, we talked about unhealthy diets. Unhealthy diets like eating junk foods, eating of unhealthy foods like the canned foods and the rest of them, smoking, alcoholism, and the rest of them can contribute to the risk factors that we see in diabetes mellitus. All right, we also talked about lack of physical activities, lack of exercises, and the rest of them. All these things we enumerated that contribute to the risk factors in diabetes mellitus. Also, being overweight or obese. If you are obese, this is one of the risk factors contributing to diabetes mellitus type 2. And lack of physical activities, we've said, and also stress. Stress can also contribute to development of diabetes mellitus. Now, let's dive into what we discussed at the signs and symptoms of diabetes mellitus. Our team, we are able to enumerate what we term at the 3 Ps: polydipsia, polyphagia, and polyuria. We also have glycosuria. All right, let's dive into one of these: polyphagia. Polyphagia, we also discussed that because of cell starvation, because the glucose cannot get into the cell, the body is starved of glucose, and then what happens is that the body triggers through the biochemical mechanism in the body. It sends that signal to the hypothalamus, which triggers that the body is hungry, and that is why you see most people with diabetes mellitus, they eat a lot. They tend to eat a lot. That is what we call polyphagia. All right, we talked about polydipsia. Polydipsia, what happens in polydipsia is that because hyperglycemia, because glucose is osmotic, is solute, it has osmotic properties. It attracts water. When attracting water into the blood, then it's also dry water from the cells, from the intracellular to the intravascular, thereby shrinking the cells, causing dehydration. This dehydration also sends information to the hypothalamus, triggering the test sensation. This test signal is now what we see as people tending to drink enough water, as we know as polydipsia. All right, let's talk about polyuria. Because this glucose, when it gets to the kidney, it exceeds this what we call glomerular threshold. Now let's discuss polyuria. In polyuria, because of excess glucose in the blood, when it gets to the kidney, because the glucose exceeds the absorption of glucose has exceeded the tubular threshold, which is about 180 to 200 milligram. Okay, when it exceeds this, you see that some glucose will now be spilled into the blood, into the urine, and because of glucose is osmotic in nature, it attracts water, and attracting this water, it leads to what we call osmotic diuresis. So that is why we have people with diabetes mellitus tend to pass more urine than normal. That is what we call polyuria. All right, now let's go into glycosuria. Why do people with diabetes mellitus have more glucose in their urine? You may find out that when a person with diabetic mellitus passes urine, you may see that there may be ant infestation. This ant infestation is because of the glucose there in the urine. Okay, now what happens is that when the tubular threshold is exceeded, which I said earlier, that's about 180 to 200 milligrams. Now, what happens is that the excess glucose will now be spilled in the urine, and that is what leads to glycosuria, excess glucose in the urine. All right, there are two conditions that we have to discuss about diabetes mellitus, and one has to do with type 1 diabetes mellitus, and the other has to do with type 2 diabetes mellitus. One is diabetic ketoacidosis, what we call DKA, and the other one is HHS, hyperosmolar hyperglycemic state. Now, let's discuss this in details. All right, there are two conditions that are very important for us to mention as we discuss diabetes mellitus. One is DKA, what we call diabetic ketoacidosis, and the second one is HHS, which is hyperosmolar hyperglycemic state. All right, now let's discuss this in detail. All right, in lipolysis, the body uses fats and oil, breaking it down to free fatty acid and glycerol, from where we generate keto bodies. Ketones are now used in the production of energy, which accumulates in the body. This accumulation of ketone bodies leads to what we call ketoacidosis. HHS, which is hyperosmolar hyperglycemic state, is a life-threatening condition whereby the blood sugar rises above more than 600 milligrams per dl. And in this case, there is no ketoacidosis. All right, it leads to dehydration and hyperosmolarity. The osmolarity rises above 320 milligrams. This can lead to neurological symptoms and even coma. Let's look into the complications of diabetes mellitus. One is CKD, chronic kidney disease. High sugar level can damage the glomerulus of the kidney, and this will lead to chronic kidney disease. It can lead to decrease in glomerular filtration rate. Next is peripheral neuropathy, as seen in diabetes mellitus. This is loss of sensation, where we see tingling and loss of nervous supply due to clogging of the vasculatures. Okay, this can also lead to what we call diabetic foot ulcer, as we see in most diabetic patients with non-healing wounds. In cardiovascular disease, we have chronic hyperglycemia accelerates atherosclerosis, as you can see in people that are obese. This can lead to endothelial damage and plaque formation in the blood vessels, leading to strokes and peripheral artery diseases. Accumulation of sorbitols in the lens of the eyes can lead to blood vision. It can also lead to the nervous damage. In our preventions, all right, we have to engage in at least 150 minutes aerobic exercise weekly. That is about 30 minutes exercise daily basis. On diets, let us use what the WHO approves, known as DASH diets. In addition, let's monitor our blood sugar level regularly and consult our healthcare professionals regularly. Let us adopt these procedures, these tips that we have said. I believe this information we provided with our discussion has helped us to understand more about diabetes mellitus. Please, let us stay healthy with the global heartbeat, and let's build a healthier world.